Now to proceed to our second lecture. Our second lecture will be discussing about effective communication techniques for special needs children and their families, a dentist guide. Most often, communicating and teaching correct dental care to special needs children and their families can be quite challenging, especially for us dentists. And understanding the cognitive development is key in developing this task of communication. Specific strategies will be discussed by Dr. Sia to guide dentists in their clinical work and their management. To further know our lecturer for this evening, Dr. John Harold Sia is a board certified developmental behavioral pediatrician by the American Board of Pediatrics and the Philippine Society for Developmental and Behavioral Pediatrics. Dr. John Harold Sia underwent residency for pediatrics at the State University of New York, Health Science Center at Brooklyn, United States of America, and then he continued for his fellowship training in developmental behavioral pediatrics at the Yale School of Medicine. He has given numerous lectures on children with special healthcare needs, including those on topics regarding adoption and foster care. Dr. Jan has also co-authored several studies recognized by the international journals and by the Centers for Disease Control. Currently, Dr. Jan attends to his patients at the following hospitals such as the Makati Medical Center, Manila Doctors Hospital, and the Medical City South Luzon. Dr. Jan Harold Sia is a loving husband and a proud father of two. So let us please welcome our second lecturer, Dr. Jan Harold Sia.
Anyway, so I would like to repeat my thanks to the organizing committee and also to Francis because he made my work easier. There's a lot of overlap in our lecture. But as I was saying a while ago, repetition is good so that at least the dentists in our program today will remember how they will communicate and how they will address the needs of these children. So in any case, my topic for tonight is on effective communication with special needs children and their families, a dentist's guide. Okay, so I have no disclosure. So these are our objectives. Hopefully, at the end of my talk, we hope to answer these questions. Who are the special needs children with communication barriers? What are the barriers or challenges to effective communication with special needs children and their families? And what strategies or techniques can be used to effectively communicate with special needs children and their families? Okay, so children with special healthcare needs, they present a unique set of concerns for oral health for several reasons. So first one is they are prone to developing caries. They may be at higher risk for complications or systemic infections from oral diseases, and they have difficulty in understanding and assuming responsibility for preventive oral health. They may also require more help with their oral self-care routines than typically developing children. Okay, so who are these? Okay. So who are the children with special healthcare needs with communication problems? As mentioned by Dr. Francis a while ago, there are representative groups. Okay, and first one of them are those children with intellectual disability. The conditions that I'm going to present today are certainly not exhaustive. They are examples. Okay, and there are more to children with special healthcare needs. So who are the children with intellectual disability or ID? So the old term for this one is mental retardation. ID is characterized by deficits in general mental abilities and impairments in daily functioning compared to same age peers. They may have some academic skills at the level of the early to late elementary at best. Okay. The next group are the children with autism spectrum disorder, or ASD. So ASD is characterized by impairments in reciprocal social communication and social interaction, and the presence of restricted, repetitive patterns of behavior, interests, or activities. Now, autism spectrum disorder is often associated with intellectual disability. Okay. The next group are those children with language disorder. So language disorder is characterized by difficulties in the acquisition and use of language. There are deficits in the comprehension or production of vocabulary, sentence structure, and discourse. However, language disorder is not associated with intellectual disability. The other groups of children with communication problems, with special healthcare needs with communication problems include those with visual and hearing impaired, those with motor disabilities, and those with craniofacial anomalies. The last two groups, motor disabilities and craniofacial anomalies, are often associated with intellectual disability as well. Okay. So let's talk about now the potential barriers for communication. Okay. So first potential barrier is the cognitive skill of the child. Okay, and the parents too sometimes. No? So maybe you've experienced this in your own practices. The next one is language. The language barrier itself, meaning the differences in dialects. Okay. So it is really suggested for dentists to use simple language and don't assume that everybody speaks and understands English fluently. Okay. It is also recommended that we avoid the use of medical jargon. The next barrier is the language skills itself, as I've described earlier. Now, differences in oral health goals. So this is another important potential barriers because so it's important for dentists um, to know immediately what are the family's goals for the child's oral health. Okay. The next barrier is a child's behavior and self-regulation. So during the visit, if the child is very disruptive, it can potentially disrupt the conversation with the parents about the oral health care of the child. So it is important that the child is, it is important to calm the child first before the dentist proceed with the discussion. Okay. The next one is the limited time during visits. Okay, so I'm sure you're all very busy dentists, and I think it's important to put it out there that time is really a luxury, okay, in all aspects. So it's important that you plan ahead, and you may need to schedule a visit just for educating the parents. Okay. So the key to the nuts and bolts of communicating with all children, including children with special needs, is guided by understanding the child's cognitive development theorized by Piaget. So I will just run through this. Okay. So the first group, the first age group is the 0 to 2 years old, which is the infancy to the toddler years, and this is characterized by the sensory motor stage. So children at this age learn through direct sensations and motor actions. And they master concepts such as object permanence, causality, spatial relationships, and use of instruments. The next group is the 3 to 6-year-old group, the preschool years, characterized as the pre-operational stage. So the mental processes are governed by the child's own perceptions and linkage to events. So there is no separation of fantasy, which is their internal reality, and the external reality. They have a sense of animism, magical thinking, egocentrism, and transductive reasoning. So animism means that objects have life, okay? And egocentrism means that the child's understanding of the world is based on their perspective only. So they think that how they think is actually how all others think. So that is egocentrism. And then transductive reasoning, on the other hand, means that children assume a causal link or a permanent association when two events are experienced in close proximity. Okay. The next stage is the 6 to 11-year-old group. So the middle childhood, which is the concrete operational stage. Here, children can reason through real and mental actions on real objects. They can reason with a stable rule system. They can understand some patterns, and they can see another person's perspective. Okay. And the last stage is the formal operation stage for 12 years old and older. Okay. Here, adolescents and young adults and adults can reason about ideas, impossibilities, and probabilities. They have mastery of abstract concepts. They exhibit inductive reasoning and complex deductive reasoning. Okay. So why is communication important in dentistry? Okay. Well, just like in any other health-related field, it has been documented consistently in the last 5 decades that the doctor-patient relationship and communication are the strongest predictors of the outcome of a health visit. Okay. So let's start off first with communicating with the parents. Okay. So this one, Dr. Francis mentioned a while ago, active listening. Okay. So you need to let the parents know that you are listening. This is a very basic skill. Okay. And what are the body languages that convey a listening attitude? So this would include, oh, there you go. So sitting down, looking at the parent at eye level, leaning forward and showing interest to what the parents have to say, and showing appropriate concern. Okay. And then you should also respond appropriately, to parental affect or emotional tone. So how the parents are feeling as they are conveying to you their concerns, or just for any sharing of experiences for that matter. Okay. So an example with this would be if a parent tells you, "Naku doc, ang hirap talagang sipilyuhin nung ngipin ng anak ko," you can say na, "Naku, ang hirap pala talaga para sa inyo. Pagod na pagod siguro kayo." 'Di ba? At nakakalungkot siguro para sa inyo. So that is really responding to the tone. So looking at how they are feeling, the emotional content. The next one is dentists should facilitate and guide the dialogue. Okay, you do not dominate the conversation. Okay, you use open-ended, non-judgmental questions. So, for example, if you want to know how they brush their teeth, the way a suggested question would be, tell me how you care for his teeth, rather than do you brush his teeth? Kasi pag yes ang sagot, edi okay, pero pag no, di ba parang ang sama-sama naman ng magulang. Okay. Elicit parents' concerns, goals, and expectations early in the visit. So this is what I was telling a while ago. Most of the time, this conversation on concerns and expectations may reveal unrealistic expectations from the parents. Okay. However, sometimes it may make the clinician's job easy if reassurance is all that is needed. And thus, it will help direct your conversation with the parents. Okay. Uh, Use common courtesy. Okay. So what is this? So greetings, diba? Introducing yourself, introduction. Um, Now use the names of the family members as how they introduce themselves. So this is somehow a pet peeve of mine. No? So I mean, not just for medical doctors, pero siguro for any healthcare professional. When these healthcare workers, they call the parents mommy and daddy. Mommy, upo po kayo dito. O daddy, kamusta pong anak ninyo? But if you think about it, the healthcare professional is not a child of the parent. So it's really inappropriate for the healthcare professional to call this a very personal and endearing name, but to the parent. So it's better if the parents did not introduce themselves, then just use common courtesy. Good afternoon, Mr. and Mrs. Sian, diba? Unless they introduce themselves, hi doc, ako po si Harold. Then you can use the family member's first name. Okay. Redirecting discussion. I'm sure you have experienced patients or the parents of patients wherein they have a lot of stories to tell. And so, the direction of discussion goes wayward. So ito, it's a job of the dentist to really redirect the discussion, respectfully. Yung may swabe naman, di ba? There's a natural pause naman in the discussion. So you just have to be astute with that natural pause from the parent talking, and then immediately say na, oh sige po, let's go back to the original topic on brushing teeth, etc. Okay. And then finally, you should make closure and the agenda setting explicit. So at the end of the visit, talagang you have to review, okay, this is what we did today, this is what our plan, this is what we should do, and then I'll see you, on so and so. Diba? Para clear yung plan. So sabi nga ni Dr. Francis, diba, make a treatment plan. So what are some of the communication or teaching strategies? Telling, okay? So this is really explaining, providing information, and giving direction. And then the next one is showing. So this is demonstrating an action, maybe using a 3D model, drawing and showing pictures. Okay. And then Providing resources. So as another strategy, so this, practically providing handouts, videos, websites. I'm sure some dental clinics are very savvy. Di ba? Meron sila mga videos na habang naghihintay while the parents are waiting, pinapakita yung ano yung mga kailangang gawin, how to care for the child's teeth. Okay. So the next slide, ito, well, it's clear naman. I'm sure you all know this. So showing the parent what is, rice grain size toothpaste, a pea-size toothpaste. Some dentists, at least for my child's dentist, he described, ano ba to? He described it as 4 bristles of toothpaste. Okay. So it's really important again. So it's merong oral education, so naririnig ng bata at ng pamilya, and then they also see it. Okay. Another strategy is questioning. Diba? So, however, you should ask questions one at a time and allow time to answer. Usually mga 5 to seconds. Diba? Practicing and return demonstration. This might be a little bit difficult, no? But again, if you pag-experiential kasi ang learning, it's much easier for the parents to learn. Okay. And then, oops. Giving constructive feedback. So how you do this is restating and clarifying. So if a parent, tells you something kung ano yung ginagawa niya, it's really just rephrasing. Parang you will just echo kung ano yung sinabi niya. And also, yung clarifying statements, it tells the parent that you are really listening to what they have to say. So let's talk about now. Okay, here. Communicating now with children with special healthcare needs. So before the visit, I suggest you obtain information. You obtain information about the child, diba? So information about communication and behavioral patterns, the level of understanding, and then maybe you should schedule a separate parent or caregiver appointment just to talk about the child. At least in my practice, and I'm sure maybe with Dr. Francis as well, there are many times wherein we schedule an appointment just for the parents. Kasi you will have the parents' attention 100%. Diba? Hindi sila distracted, hindi nila iniisip how the child is doing, baka nakakasira na ng kung ano. No? So at least if you have the parents' 100% attention, you'll be sure na the parent would understand what you have to say. At ikaw rin. Diba? You will understand, you have a full understanding of their concerns. Let's talk about what are the things you should avoid first when communicating with children with special needs. So avoid threatening. Okay? Pag hindi mo to ginawa, whatever. So pag hindi ka naupo dyan, ganito mangyayari. So hindi maganda yun, di ba? So, and number 2, using false situational outcomes. So ano ibig sabihin nito? If I don't clean your teeth, example lang ha, if I don't clean your teeth, you will not eat cake anymore. I mean, of course, di ba, you cannot assure the child, you cannot guarantee that to the child, di ba? On third one, avoid using fantasy as a rationale for the visit or procedure. So naisip ko lang dito is yung tooth fairy, pero wala naman tooth fairy sa Pilipinas, di ba? So example, di ba? This is what the tooth fairy wants for your teeth. Parang, di ba, para you're just feeding into the fantasy na hindi naman. And then lastly, avoid putting the child on the spot. So what is an example of this? Yung sasabihin mo yung bata, hindi ba matapang ka naman? Aren't you brave? Boys don't cry. So it minimizes their own thoughts and feelings kapag gaganon. So it's really not going to be a very good communication relationship when you use at least these 4 no statements. So what should you do? Ito, again, reiterating what Dr. Francis said, you build trust with the child. You start with a getting to know me dental visit. So yung nothing to do, talagang just get to know the child, diba? So in our practice as DevPeds, we always talk about yung what interests the child. So ito na yung using icebreakers. I observe what the child is wearing, diba? Ano yung shirt? Kung babae, meron ba siyang parang naka-ponytail, clips, or did they bring a toy, any object, and then I start the conversation using those things that I observe. So for example, naka-Superman shirt. Oh, I also have a Superman shirt. I really like Superman. So, icebreaker nga. And then use a casual conversation. So parang hindi doctor visit, parang just in the park, and then you meet a friend, and then strike a conversation. So that is one way of building trust with these children. So as you can see, diba, this will also work for typically developing children na preschool years. Okay, use simple and concrete language, as mentioned earlier. Um, So remember, the cognitive level at best of intellectually disabled patients is in the early to late elementary years. So very concrete language talaga. So for example, you say, first you will sit on this special chair, then you will open your mouth, then I will count your teeth, etc., etc. So para they can predict what's going to happen next. Okay. Use words according to developmental level. Okay, I think this is um, repeated na. Repeat what you said and then repeat it again and then say it again. So pero syempre there are pauses in between just to make sure na talaga naintindihan ng bata. Okay? Take your time, speak slowly and calmly. Okay? So that you'll know na talaga naintindihan ng bata, and you only speak when you actually have the child's attention, not when during the time na parang busy siya sa kung ano man. Okay. Give one direction or instruction at a time. So the example I gave a while ago, diba? First, you sit here on this chair. Then you wait for the child to do it. And then open your mouth. And then you do that. And then next, so ganun yun. Give an opportunity for the child to follow. And then for children who can, ask them to repeat what you said and give enough time to respond as well. Next one. So tell and show the child if you understood him or her. So again, affirmation, diba? That the child's thoughts and ideas are important to you kasi they are a partner in the care of their own teeth. And the next one. So here, the tell, show, and do. So I think paulit-ulit na to, diba? And then narrate all of your actions. So narration is really, literally narrate. So as you're doing it, you tell the child what you're doing. So first, I'm going to turn on the lights. It's going to be a little bit bright, so you can close your eyes. And then I will count your teeth like this, 1, 2, 3. And then, I'll spray this one. And then you will rinse your mouth in this, small bowl. So importante talaga. It's very important for children with special healthcare needs to know what's going on. And then show and demonstrate. Oops. Okay, show and demonstrate how the equipment works before using. So again, emphasizing what my good friend Francis said a while ago. So ako personal experience, parang natuwa ako na oo nga no, it was a good idea. So my child's dentist, ang ginamit niya yung brush, i-brush muna niya doon sa kuko ng anak ko. Sabi ko, oo nga no, parang di ba yun yung feeling. Tapos magbibilang muna doon sa fingertips, and then lalapit, magbibilang sa may elbow, and then magbibilang sa may shoulder. So my child is typically developing. So pero 'di ba ang ganda ng effect na even for typically developing children, this is very, very useful. What more for children with special needs? Okay. And then use visuals, pictures, and picture schedules. So the visuals, so ito yung showing what is expected behavior, what is appropriate behavior in a dentist's clinic. You can also use the visuals or pictures for yung dental care. I think Francis showed this a while ago, and also as a point or reward system. So ito naman in partnership with the parents. Na if the child shows his behavior, he gets a 1 point, and then for this behavior again another point, and then at the very end you add up yung points, and then there's a reward afterwards. Syempre yung reward ibibigay talaga dapat ng parents, but you as a dentist can give your own reward then. Okay. Pero mas effective kasi yung reward from parents And then use a timer. Okay, so para kasi they may not have a sense of time na ano ba ang 8 o'clock, ano ba ang ganito 9 o'clock, 30 minutes. So use a visual timer. No, meron akong papakita dito mamaya. Okay, here. So again, just an example of the picture schedules or visual supports. You can look this up online. Maraming free na ganito.
another example. So ito nakalagay pa, di ba? There's the verbal component. The dentist will ask you to open your mouth, pero meron din yung mga visual support describing what's typewritten. The dental office vocabulary. Okay. And then this is the timer I was talking about. So this is a visual timer, visual and audible timer. So the red part, ito you can move that eh. So halimbawa, it's a 45-minute procedure. So you move the hand to the 45-minute mark, and then magka-countdown yan. And as the time goes down, mawawala din yung red panel na yan. And then when time is up, meron din magkakaroon ng timer. Okay. Okay. So be consistent in all appointments. Okay. So and this includes consistency in time, the day, the staff, and the room. Okay. So para familiarity talaga helps in calming a child with special healthcare needs, especially those with autism. Okay. And then use labeled praising and attention. So what is labeled praising? It's not enough that we say good job. We have to really say what we are praising. For example, good job for sitting quietly on the special chair. Okay. You were very quiet. I really like that. Oh, wow, you open your mouth really well. Awesome job. So mga ganong klase, talagang you have to be concrete. You have to tell ano yung nagugustuhan mo. Kasi otherwise, children will not know what do you mean by good job. Diba? Be attentive to the child's behaviors, vocalizations, and facial expressions, no matter how trivial they may seem. Okay? Kasi this may be the child's way of communicating to you whatever he is feeling. Diba? So, kung halimbawa, nagmi-misbehavior na siya or gusto niya umalis, baka talaga natatakot. So, ganun din sa vocalizations, any form of whining or grunting. Facial expressions, kung talagang makikita mo rin naman doon kung okay lang ba. Yan. So, and then, after observing those things, you acknowledge the child's feelings and reassure as necessary. So, there are times kasi na it's hard to, we can't read minds, diba? So you can only interpret. So you can say, okay, you must be very scared right now. And then you can assure, I will do it as quickly as possible and yung magaan na kamay, and then it will be all done. Okay? And then afterwards, you praise. Well, thank you very much na talagang you were able to sit there quietly for 5 minutes. So ganun. Okay. And then after making sure na the child is not in pain or having discomfort, you can ignore the other minor misbehaviors na. Kasi the minor ones, if you ignore them, mawawala din naman yan eh, yung tinatawag na behavioral extinction. Okay? But certainly you cannot ignore yung mga medyo unsafe behaviors. Okay? Now for the visually impaired, of course, and it's really recommended that you use tactile feedback as well. And then for the hearing impaired, for the hearing impaired, if the child uses sign language, ask help from the parent or an interpreter. No? Usually sa United States interpreter, pero mali natin baka dito meron na rin. And then keep background noise to a minimum. And then remove your mask or use a portable speaker. Diba? Now, since COVID ngayon, diba, we're all required to wear a mask, a face shield. It's really, I really suggest that you put a big picture, yung talagang madali makita in the clinic, in the cubicle, para alam nila. So, kasi it raises fear, diba? It decreases the fear from the child. Who is this, person wearing a mask? You can only see the eyes, with bushy eyebrows. Who knows? So, para mawala yung takot ng konti at yung anxiety. And for those children with alternative and augmentative communication system, so what are these, especially those who are nonverbal or minimally verbal, I really recommend that you request the parent or require the parent that they bring this communication systems. Kasi it's going to be your way or the child's way of communicating with the dentist and all the adults in the clinic. So this is an example of all the augmentative communication systems starting from the low-tech devices on the left lower corner. So meron yung sticker boards, communication boards, up to the high-tech versions on the right upper corner. So nandyan yung text-to-speech devices and applications, sometimes eye-gaze devices. Okay. So in summary, we discussed who are these special needs having communication barriers. We discussed the barriers and challenges. to effective communication with special needs children and their families. And I shared with you some specific techniques and strategies that you can use to effectively communicate with this special population. Uh, okay, so these are my resources: so mcoralhealth.org, brightfutures.aap.org, and again the printable charts, which are all over the internet. Sure, you can be resourceful in that one. Okay, so we can do it, diba? So with that, I hope that more of you will take action in meeting the oral health needs of children with special healthcare needs and say, we can do it, diba? Because all children deserve a smile on their faces and happiness in their lives. So thank you very much for your attention. Oh,
Thank you for
thank
your
you po.
lecture. It was indeed very practical. You gave practical examples, even dialogues, and things that both the specialist and the general practitioner can do in their practice when they are about to manage a child with communication challenges. And before we proceed to our question and answer portion for both you and Dr. Dimalanta, we wish to award your certificate of appreciation awarded to you by the Philippine Pediatric Dental Society and the University of the Philippines Manila College of Dentistry. This electronic certificate is awarded to Dr. Jan Harold Sia in grateful recognition of his participation as a guest lecturer and for sharing his expertise and knowledge through the topic Effective Communication with Special Needs Children and Their Families, a Dentist Guide. Given this day of September 25th, 2020 during the Philippine Pediatric Dental Society String of Pearls webinar series. This certificate is signed by Dr. Paul Abaya, PPDSI President, Dr. Rowena Castro, the Awards Committee Chair, Dr. Hazel Sunico, the Scientific Committee Chair, and representatives from the UP College of Dentistry, its Dean, Dr. Danilo Magtanong, and the Coordinator for Continuing Education, Dr. Jean Arevalo. Thank you very much, Dr. Jan Sia. Dr. Sia and Dr. Dimalanta, are we ready for the question and answer?
Yes.
Yes.
Can I just greet Harold because it was his birthday? And, di ba,
Hindi
kahit,
pinalagpas.
syempre kailangan kasi di ka sumagot nung bumati ako happy birthday, John Harold Sia, who's a loving husband. Yun. Okay.
Thank you, Francis.
Okay.
Dr. Sia, happy birthday in behalf of Philippine Pediatric Dental Society. Unahan ako ng Dr. Dimalanta.
Akala ko hindi nyo
Thank
alam
you.
eh. Okay.
Ihuhuli ko po sana, baka mahiya.
Okay. So, sinabi pa niya sa inyo na birthday niya?
Of course not.
I stalked him.
Stalker
Tamo?
na, sige.
Ang dami ng ano. Okay.
Opo, we are organizing kasi. Alright, so let us prepare for our question and answer portion. Now, we have a few questions for both of you and for each of you individually.
Okay.
For Dr. Dimalanta, for those children with Down syndrome, is there a spectrum of learning disability, or those with Down syndrome are just typically affected with mild learning disabilities and they are able to comprehend well with regards to language and social interaction skills?
Well, as you said already, it's a spectrum. So you can have those who have cognitive deficits and Down syndrome, which Harold mentioned earlier. We don't say mental retardation anymore, but intellectual disability. And it can be from one that's low functioning to a high functioning one. I've had patients who completed high school, well, not because the mom owned the school, but then she also runs marathons and is gainfully employed. So you have that wide range of children with intellectual delays.
Right. What about their social interaction skills? You mentioned earlier that there are those with Down syndrome who may tend to be uncooperative. Do they also have a tendency to, like self-mutilating behavior, or may become aggressive when they enter adolescent stage?
Most definitely, and that's because it also happens to children who are typical. not preparing them for something like a big major procedure like going to the dentist will really scare any child. I was scared of my dentist ever since, and she just held me, but parang by the head, and that's why I'm traumatized that every time I come to the dentist, I really. No, I stiffen up, and I keep telling them, please put me to sleep because of my very traumatic experience. So I guess it's the same thing for them. I don't know if Harold had a good experience with his dentist, but I was really parang traumatized majorly, and I can't uh, what do you call this? Take the sound of that drill. Once it goes, I know it's gonna come in and gonna hurt me. So, baka may sensory issues din ako, di ba? So, in fact, I would like first and foremost to commend all of you. I saw about 285 of you who are working with special needs children, lalo na in COVID. Can you imagine? You're wearing your entire outfit, and then you have to go through this, all these other things that you have to use just to get into the mouths of these children, and you're the one. I don't think none of you will not be scared, di ba, now with this. But so you are supposed to be heroes for having to continue to do all of this. Kami ni Harold, face-to-face, hindi pa namin ginagawa. Nag-face-to-face ka na ba? I'm still online and I'm scared. Nag-face-to-face ka, tapang mo ha. And I'm going to go back to my clinic probably in January already kasi I just cannot risk being reinfected, so to speak.
So because of that, maybe we should refer you to Dr. Paul Abaya for your dental appointment. All right.
PTSD.
Pedya ko, pedya.
All right. This is a shout out to Dr. Paul Abaya. Kindly set an appointment with Dr. Dimalanta.
Home service.
Yes, home service po. We have a question for Dr. Sia from our audience. For children with maintenance medications, is it necessary to obtain a clearance from a pediatrician prior to a dental procedure? Maybe he's asking particularly those dental procedures that might be invasive or involve bleeding, maybe, or sedation, probably.
I think that really depends on the maintenance medication. Kasi, for example, maintenance medication, asthma. If there's no clear cut or very significant drug-to-drug interaction, then you probably don't need pediatric clearance. I think the only cases, ito medyo GenPeds na to, no, hindi ako makadunag di GenPeds na eh. Really for those na if the risk of having carditis eh, 'di ba yung rheumatic not rheumatic pero yung from invasive procedures nga tapos infection. So I think yun yung naisip ko pero really it depends on the medication.
Yes,
I don't know if kasi Francis maybe can add something to that.
No, I think sometimes even when they ask us for a clearance, usually you have a form that you send us. I think it's easier when you do that for us. And all you want to find out, I think, would be, like Harold mentioned, the bleeding tendency, right? So if they're on any medication that will compromise the dental care that you're giving, then I guess it has to be done. But we work in tandem, right? Sometimes I tell them I don't need to do the CBC X-ray urinalysis for a dental procedure. So I would trust your instinct when you would want to refer to us as general peds to give that clearance.
Yes. As a member of PPDS, I think I agree with your answers that a clearance from a pediatrician really depends on what maintenance medications the patient is on and what kind of invasive procedures is planned. Yes. And then what about if the child is already apprehensive when visiting the dentist due to sensory issues or association of fear with the dentist? What strategies can we do to remedy this? And, to rebuild trust with the child. I think especially if the trauma came from a previous dental procedure, how can we build trust again?
It will take a long time. Oh, you want to answer muna, Francis?
Trust issue, parang si Harold, di ba? Ang kailangan, I think, is again, before the child comes, you have to win them already. And syempre, all these children, then, di ba, very short ang attention span nila. So they need you to be really focused with them. Parang the faster you deal with them, the easier. Have a firm voice, di ba, na calm. At saka marami naman sa inyo, may TV na dun sa top. So that will really make this child distracted from having to do the procedure. However, mahirap kasi pag merong underlying fear to begin with. Like, uh, I'm more than 50 and I'm still scared of my dentist, so I don't even know how to get over that fear. More so pa yung special needs children. So I think it's more of a technique that you have to learn, that all of you know, because you're all pediatric dentists. And like I said, hats off to you. For an adult, ang hirap hawakan, lalo na child, lalo na special child. So I consider you my heroes.
You know, ang masasabi ko dyan, ano, kasi the question, di ba, if has to undergo tooth extractions but really apprehensive, I'm sure yung mga bata na may special healthcare needs, ito, parents will not bring them for like a routine dental visit, probably just because of the fact that they have special needs. At siguro, they will only bring their children to your clinic pag meron ng problema eh. And most of the time, they are apprehensive because something is, you know, irritable or
Bothering them.
painful sa mouth nila. So, kapag ganoon, you know, more than the fear, I think it's really removing, you know, the irritant eh. At kapag ganon, I think there's no way but to really sedate the child. Kasi unless siguro na sabihin natin ano na very mild intellectual disability, tapos verbal naman, tapos kung mabibigyan mo naman ng konting pain medication, kung makakausap ka na maayos, maybe pwede pa siguro na clinic, tapos hindi kailangan i-sedate. Pero most of the time talaga ho, you may need to really call your anesthesiologist friend to really sedate that child, or conscious sedation.
Yes. Most often, since patients come in with a complaint already, we are forced to manage the complaints first, the pain, prior to building trust with the child. Kumbaga, we build trust with the child pagkatapos na natin ayusin yung problema. Yeah, sometimes talagang ganun ang nangyayari.
Yeah.
Now, what about earlier, Dr. Sia mentioned that we prefer to use specific names for family members. Tinamaan po ako personally because I tend to call the parents as mommy or daddy. I admit that I often call them that way. So how about, is it appropriate if we call them a mommy and then their name, like Mommy Cat or Daddy Jan? Is that all right po? Is it acceptable?
You know, it really depends. Kasi you think about it. For example, you're the mother, and then this dentist calls you Mami Mia. Di ba? Ako, personally, you know, I reserve that very endearing statement or name to my
Pero
children.
Tito Doc, pwede ka.
Tito Doc, pwede pa siguro, di ba?
Pero dapat...
Pero yung mommy and daddy, I think that is a very specific title eh. That is reserved to, you know, very special people. So, yun lang. Kasi sometimes kasi if we use yung mga mommy, daddy, or mama, papa, it gives the impression. Ito, I'm speaking from experience naman, no, as a parent. It gives the impression kasi na, ay, hindi mo ako kilala, no? Parang parang my name is really not important to you. Now, that's me. Kasi, di ba, DepEd ako, professional ako. This is what I do in my work. Pero what if, you know, for other parents who are, you know, not medical professionals or mental health professionals, you don't know if it's really bothering them or, you know, it's they mind it. So, I think professionally talaga, di ba? Let's call them formally by their names na Mr. and Mrs. Sia, di ba? Kung nagsabi sila, Doc Harold na lang po, okay lang. Sige po, Sir Harold. Pwede pa yung Sir. Sir Harold, Ma'am, di ba? Lalo na sa culture natin, yung
Your Royal Highness Harold.
the seniority, the respect. So, unless they give you permission, you can explicitly ask them, oh, okay lang po ba, tawagin ko po kayong Mami, you know, Mami Jane, di ba? Or Daddy Harold. Kung sinabi na lang, oo,
Mommy Jane, you Tarzan. Okay.
Kaya ganun. So it's okay to ask permission. Actually, it's a lot better nga to ask permission.
How do you want to be addressed?
Oo, di ba? Kasi it tells you know, you are conveying to the parents that their name is important. Diba? And that you're really building this relationship. And then, importante yun, kailangan magtulungan kayo. Hindi yung kagaya nung dentista ni Francis, talagang hinedlock siya, wala nang pakialam, bahala na yung magulang niya. This is my clinic. Parang ganun yung nangyari eh.
Kasi
Diba?
kaibigan ng nanay ko kaya inis na inis
Isa pa
ako.
yun, di ba? So ano ngayon ang naisip ni Francis sa kanyang nanay? Konsyaba pala. O sige.
Maybe that is something that we can add to our practice. We can ask the parents if it is okay to call them their first name, their designation mommy, and then their name, if they do not mind. On our end, because we try to make the experience as warm as possible. So sometimes we call them mommy or as informal as possible so that they would feel at ease and warm up with us easily.
But that is the thing, Mia, di ba? The making them feel informal is actually your own thinking. By your own interpretation.
Your
and
perception.
You are thinking, if the parent is thinking the same way as you do. So yun yung medyo na i-ignore natin eh. We just assume. So yun. But anyway, it's it's a work in practice. in progress pala, work in progress.
Thank you for sharing that, Dr. Sia.
Yes.
Another question for Dr. Dimalanta.
Yes.
Are there any medication contraindications, especially for children with Down syndrome, since they have usually large tongue and periodontal conditions, or which may lead to eventually breathing problems? Is there any medications that the practitioner should be wary of?
I would think if they had other comorbid medical conditions, then there would be. But as a child with Down syndrome per se, kung wala namang allergies, cough, and all of that, heart disease, hindi naman pwede. I saw a question there na natakot nga ako yung unang question, diba? When to use your mouthwash and everything. And I think that has to do, bigla ako nagpanic sa question. And I think it has to do with the severity yata of the disease that where you can use it, diba? Like the periodontal disease, you use one for surgery na and the other one for a lesser kind. So in terms of the other oral medications that they take, for as long as there are no contraindications to the medication you're going to give, because most of the time the medication you'll give will be what they call this, to numb, diba? Anesthesia. So I don't think there would be any unless there's a medical condition.
All right. Thank you for that, Dr. Francis. Regarding the mouthwashes, maybe we can help you in answering those questions. There are 3 questions with regards to the mouthwashes. We will answer them later towards the end of the Q&A portion. Another question from one of our members of PPDSI is, what advice can we give parents for children with special healthcare needs when the child exhibits repetitive behavior that can actually become injurious to the child, such as lip biting or putting sharp things in the mouth, skin picking, head banging on the wall? How can we help in lessening or decreasing the tendencies for these self-injurious behaviors? How can we divert such behaviors to a much safer one?
Harold?
Ako ba? Okay.
Your Royal Highness?
Sige. My answer to this is actually more questions, diba? What is making this child exhibit all of these behaviors? So, given the DepEds kami ni Francis, we need to really understand what is triggering these behaviors. Parang, is this really part, alam mo, may genetic problem yung bata. Is this really part of the phenotype ng genetic disorder? Or is there something else that is making the child exhibit these behaviors? So, I think yun talaga yun. Depende kasi talaga. And once we know the reason, then ma-address natin. So, hindi siya ganun kadaling sagutin na, hindi, ganitong sabihin mo. It's not that easy. So,
nor is it,
diba,
nor is it like bibigyan mo ng gamot lang kasi nga malikot and all, because like tama ka, Harold, diba? As you said, we have to find out why the child is being difficult and why he's exhibiting that behavior. And like sometimes we don't even tell parents to stop the stereotypes of the child, because if it calms him down, let's just figure out why he's doing it, antecedent, behavior, and consequence. And then it's easier said than done. Obviously, diba, when you're faced with the child, anong gagawin mo? Parang gusto mo nga sabihin, Mommy naman, sana inayos mo yan bago mo dinala dito kasi mahihirapan talaga kayo as dentist. Paano mo ihihiga? Di ba kung yung bata, puro steam. So, probably that should even be, maybe I should suggest, part of your pre-consult. Is your child exhibiting this? So, you know kung papatulugin mo na or hindi bago dumating para mas kalmado.
Diba? So I think talaga yun yung sasabihin, maybe you need to see the beats muna
Dr.
to
Harold
understand,
C.
diba?
John Harold C.
And Francis doing the consults. Okay. There's a very interesting question here, Francis. No?
Sige, which one did you
You
read?
have a patient. Mia, we'll go ahead na.
We'll go ahead. Yeah,
You have a
sige, tuloy
patient
mo na.
who you feel needs a DepEd intervention, but parents did not declare anything. So related to the second question, how do you tactfully tell a parent in denial their
Yes.
child should seek consult? Okay. So ako, ako muna,
Ikaw
Francis.
muna. Yeah.
Ako since the dialogue or the script that I use, for example, no, is I point out behaviors. Oh, ma'am, alam niyo po, napansin ko po na ganito yung behavior ni Harold, for example. So ano po sa palagay ninyo? Di tatanungin mo ngayon. Tapos, ganun po ba? O sige. Tapos, and then you will reflect, naku, ang hirap po siguro niyang alagaan, siguro pagod na pagod po kayo. So medyo leading, but again, at the same time, empathic of the parent's experience of a problem behavior, for example. And then, sasabihin mo, so ma'am, alam niyo po, ano po, sa tingin niyo po ba mas maganda po ang buhay ninyo, for example, kung mawawala yung ugaling ito? I'm sure sasabihin niyo na magulang, oo naman po, Doc. O sige. So alam niyo po, makakatulong sa inyo kapag magpapatingin po kayo sa ganito. So I think makakatulong po kung if we get to understand bakit po siya ganito, ganyan. And then, alam niyo po, marami pong matutulong yung doktor na ganito sa ganyang ugali. So that is very tactful kasi parang you try to really understand the parents, the family's lives, diba? How they are living with the behavior. And then magsasuggest ka na rin ng possible solution. Kasi in that kind of conversation, meron silang way out eh. Di pagkasabihin nila, interested po ba kayo na ganito? Hindi na, okay na ako. But then, sinimulan mo na nga na, ang hirap-hirap siguro, no? Tapos sabi nila, oo. Parang totoo na talaga na nahihirapan sila. Hindi sila mag-back out na, hindi ako nahihirapan.
Yeah,
So,
and
that's
very
just
much,
one way.
and that's really a good way. And ako, maybe it's the same how our Gen Peds friends will tell us, paano ba kung ayaw ko in denial? Lalo na kung doktor, di ba?
Yeah.
So, ang lagi ko lang sinasabi, wag niyong i-diagnose.
Yeah, that's
right. Di ba? Ang lagi mo lang sasabihin, I might be wrong, but I could see this in your child. And I think what Harold said is the best. You empathize first. And ako, my technique would always be, please, what are your concerns? Let's find out what are your child's strengths, and then what are areas of challenges. I don't even call them weaknesses. And then pag kunwari nakikita ko na ang likot-likot ng bata, tapos ako, sa palagay niyo po ba malikot yung bata? Naku, hindi, dito lang ho yan sa clinic mong ganyan kalikot. So hindi ko kayo tutulungan about yung nakikita kong medyo parang malikot po siya. Hindi. Sige, Doc. Paano na? Di ba? So parang, like leading questions, like Harold said, might bring it out kasi nga they can't see it. Parang they refuse to see it, lalo na kung only child yan. Di ba? Only boy. Di ba? Or a youngest or eldest. It doesn't really matter birth order. But I think it's important for you. You will be remiss if you don't tell them that they should see. And I would always tell my co-pediatricians, Gen Peds, to start with the line that I might be wrong, but it would be nice if you saw Dr. John Harold Sia because I have a direct line to him. He will see you within a week. Kasi di ba magagalit sila. Ang tagal-tagal daw namin. Galit na sila sa amin lahat. Hindi naman namin fault. Lalo pa ngayon, may mental health issues pa. Akala nila psychiatrist tayo. Di ba, Harold? So, in very much the same way, you will have to tell them, I guess, not to pass judgment right away. And I've always, thought this, that the most difficult child is the child that needs the more love and understanding. And all of you, the 256 pediatric dentists listening to us now, baka tayong merong night show, no? Baka dapat every year tayong dalawa talaga tandem dito. Magkasunod kami parati di ba? So, I think it's nice to also hear you and listen in on your lectures so that we will learn as well.
Yes, thank you for those. Bagay nga po kayong dalawa to lecture together.
Pareho pa kami ng ano.
Oo nga.
Hindi nyo kami binigyan ng headphone. Bumili kami para lang dito.
Because that's how much you love PPDS.
Yeah, definitely. Cha-charge ko yan kay Dr. Abaya. Plaridel Paul Abaya. Full name, di ba?
Yes, but don't worry because Dr. Paul Abaya will be your pediatric therapist. Now, another question. I believe that answer also applies to those for parents who do not declare in the chart or in the history, they do not declare any concerns such as those mentioned or a diagnosis of a learning disability, for example. Maybe emphasizing with them would also be applicable in opening up the concern of behavior challenges. Tama po ba, Dr.
Yes.
Francis?
Yeah.
Pwede din po yun.
You know,
Now,
Mia, I would like to add to that. No, halimbawa, hindi sinabi. So, paano nyo sasabihin ngayon? Di ba? So, siguro there will be some of you na nainis or nagalit kasi ano ba naman to? Ito lang 30 minutes na yung visit tapos hindi ko nagawa, di ba? So, it's okay to be aware of your, emotions too. But after that, mag-isip ka na ulit. So, paano mo sasabihin sa magulang? So, ano yung line ko niya? Sabihin ko, po, Mrs. Cruz, napansin ko po na sa visit natin, parang hindi po talaga siya mapirme. Parang hindi po niya naiintindihan. So parang mukhang hirap po talaga siya makaintindi ng mga, yung sinasabi ko, ganyan, etc. So you're just telling the parent what you see and what you observe. Diba? And then from there, from that observation, di pwede mo na sabihin na siguro po baka mas kailangan pa natin siyang kilalanin pa. At since hindi po ako yung espesyalista dyan, yun. So ganoon na ulit yung discussion. Okay.
Yeah, that's a very nice way to start the conversation to the parents about it.
Yeah.
What about what is your stand as pediatricians, especially specializing in children with special needs, with the use of physical restraints or immobilizing equipments, such equipments that we use in our dental practice, such as a papoose board or maybe a mouth guard, tooth pillow, for example, a mouth gag. For us, it is often necessary if the children have learning disabilities and we need to do invasive procedures for the safe way of carrying out the treatment. But as pediatricians, what is your stand with these?
Francis, ikaw muna. Since you have this PTSD with dentists.
Well, I think if it's needed, you have to do it. I wouldn't want my hands trapped in the mouth of a child. So you really need to put the guard. The papoose thing, we used to do it, tama Harold, but then now parang not anymore. But like, how do we even inject them with their vaccines if ganon? Talagang kailangan i-restrain. So I think it depends. It's a case-to-case basis, and unless somebody finds a better way to do it, to get your work done, you may have to do such maneuvers.
Ako, my thoughts on that. So, it's a very good question. I'm not sure if there are any studies showing na yung effects nung ganyan. Kasi ang goal ninyo as dentist is to get the job done. Diba? Parang do whatever. But then on the part of the child and the parents is the experience. And then idadagdag mo, what about yung trust? So kung gagawin mo ito, definitely matatakot talaga sa iyo yung bata. 'Di ba? And then sabihin natin non-verbal, 'di ba? Tapos talagang intellectually disabled. So ang tatatak lang talaga sa bata is yung experience niya na tinali siya at mayroong pinunta sa kanyang bibig at ganito maliwanag. So trauma talaga ang mangyayari. But then you got the job done. So ano ba ang gusto mo mangyari? Do you want this child and family to come back to you? Di ba, para talaga maalagaan yung oral health care? Or sige na, isang pasyente lang naman yan, tapusin na nga, bahala na. So there's really a balance. Ako po, wala tayong studies do sa mga ganong issues, but thinking as a mental health professional, developmental behavioral pediatrician, I would probably side on the child. No, na para bang why should we let this child endure the suffering and the trauma
Pero
when you can do it, huh? So when you can do it naman, there are many other strategies. Of course, there are risks and benefits, diba, ng sedation or mild sedation. So there's not one answer to this. Pero at the very end, nababagsak pa rin tayo do sa doctor-patient relationship. Diba? So if you want this child to trust you, what is the least invasive and traumatic way that you can do
Patulugin
to
mo.
make the dental visit at least a very
Diba?
a
Is
neutral experience at the least,
is to
diba?
is to sedate, which is the question of Dr. Manalastas, na
Mm.
is sedation advisable to patients with intellectual disability in doing a simple extraction? Kasi along the lines of what you said nga, Harold, it's the trust. But I'm even wanting to ask the dentists here, ilan sa mga patients yung umuuwing luhaan? 'Di ba?
Yeah.
Kasi talaga namang masakit at talagang nakakatakot ang dentist. So you may have
Hindi
mastered.
naman nakakatakot lahat ng dentist.
Hindi,
Ikaw
kasi ikaw ba hindi ka natatakot sa dentist mo?
of course
Siguro
hindi.
batok ka. Oh, what I mean is like, 'di ba, parang you have mastered that art, and I think you wouldn't even go to pediatric dentistry if you didn't have the patience, if you didn't have the nurturing way, the caring way. Kaya nga, 'di ba, talagang call it na I'm putting you high up on a pedestal, but like it's very noble of you to go into something that's so difficult. And I don't think you'll get into this profession if you didn't have the heart for it. Oh, yan. Tama, the heart.
Oo nga. Oh, alam mo, Mia, I just had a thought. No, this is a very good research topic. So for those who
Mm.
are dental students here or pediatric residents man, I mean, tayong dalawa, Francis,
Uh,
this is actually a very good research topic na ano
because
ba
no
yung
one has researched.
Oh,
Yeah.
yun. So at least to my knowledge, matagal na akong eh. Yun lang. Sige na, pa-side swipe tayo.
That is a shout out to the residents of the Advanced Education in Pediatric Dentistry who are listening with us right now. That would be a nice research topic.
Yeah.
Take note
Oh.
of those. Yung mga napag-usapan natin tonight. And I think we can deduce that Dr. Di Malanta actually had severe caries when he was young. Kasi very
No!
traumatized siya. No?
I didn't have
Probably
carie.
maraming invasive procedures ang ginawa kay Dr. Francis.
No, it was a simple cleaning. My dentist will tell you, nagulat siya sa tanda ko daw na to, totoo pa daw lahat ng ngipin ko, but it's stained because of my vitamins that I had to take. So hindi ko siya mapaputi. O di ba kaya hindi kagaya ni Dr. John Harold Sia. Ngiti na ngiti diyan para siyang merong toothpaste commercial. Oh.
Yes,
Anyway.
yes, and we would also like to add na tama naman po, as you have said, that weighing between the patient-dentist relationship and the need to do the dental procedure, as we have mentioned earlier, it depends also on the need. How painful is it? How much is the quality of life affected? If it is very painful already, sometimes we have to do the procedure first, and maybe it may require restraints or those equipments that will keep the child safe to carry out the procedure, and then we build the trust afterward, diba? Sometimes the dentist may have to resort to this and then work on the building of trust and the rapport afterwards. Minsan kailangan ganun. With regards to rewarding, sometimes we have noticed some parents want to reward their child after a dental visit, but how do we talk or educate the parents if the reward actually sounds like a bribe already? Like tinatanong, sinasabi na nila na, o bibili tayo ng cars mamaya after ng linis mo, dali humiga ka na. Sometimes it may sound like a bribe from the parent. Is that okay, or should we speak up to the parent?
You do it.
Francis.
John Harold Sia.
Gutom ka.
Alternate, di ba? Ikaw tas ako.
Itong sabihin ko. So let's define first what is a reward, what is a bribe.
Bribe, magkaiba.
Ang reward kasi, you state the behavior first to the child. Parang you set up the condition. Sabi mo, Harold, pupunta tayo kay Dr. Abaya ngayon, titignan niya ang ngipin. So, ang gusto kong gawin mo, upo ka doon ng tahimik, makikinig ka sa sabihin niya. Kapag ginawa mo lahat yon, then, bibilang kita ng whatever. That is a reward. What is a bribe? Halimbawa, pumunta na ka na ngayon. Harold, punta ka kay Dr. Abaya ngayon, tahimik yung bata. Tapos pagdating doon, Mami, ayoko na dito, takot ako. Sige na, mapu ka na dyan. Pag mapu ka dyan, bibilang kita ng ganito. That is a bribe. Kasi nauna na yung misbehavior. Diba? So, kailangan you set up the condition first. Kaya dito importante yung communication ninyo with the parents before the first visit. Diba? Parang mag-tandem kayo, magtulungan talaga kayo. Para ito yung plano ninyo, you're all on the same page para hindi nyo isasabotage ang isa't isa. 'Di ba? So, pero once na, kasi pag nagawa na yun, and parang no matter what you say, wala na eh. It's really the parent, parang yung mas importante pa rin talaga kung ano man yung sasabihin ng parent sa bata versus kung ano yung sasabihin ng non-parent. So, yun. Mag-usap, kailangan nyo talaga mag-usap.
Yes, and I think you've been able to distinguish the difference between both, and really, it's better to catch them doing a good behavior, rewarding them for that, than bribing them, because they'll always look for the bribe.
Yeah.
Diba? And I always also tell them, if you do this, then this will happen. Something like hindi naman panakot. 'Di ba? Kasi nga usually ang panakot sa amin, sige, iniksyonan ka ng doktor. Sige, dalhin kita sa dentista. Hindi. 'Di ba? Parang if you do this, then probably we can talk about this. So parang siya na mag-iisip, but if you don't do it, then I don't think I can give you this. Parang the choice is the child's, lalo na kung older child. Mas mahirap kasi pag mas bata eh.
Yeah.
Yes. Okay. Thank you for that. And since bumababa na po ang blood sugar ni Dr. Francis, I think we have to more or less cap this session right now.
Yung last one, sabihin mo lang yung getting to know you stage via telemed. The answer is yes.
Yes,
definitely. Maikli lang naman yun eh. I think it's a very, very, very good idea.
Yes. Through telemedicine and probably online.
Or pictures.
Yes, pre-screening them through the phone or maybe a social media platform such as Facebook Messenger and Viber. Tama po ba? Yes, we can tap those platforms po. And thank you for such an entertaining question and answer portion. Na I actually call this the Sia and Malanta talk show. We have made
Francis and Harold's na lang.
Very entertaining. Yes. Pwede din po. Francis and Harold talk show. Thank you very much for making this very entertaining and lively. I believe our participants really not only entertained, but really learned a lot from this session tonight.